Welcome to the Lasting Smile podcast. I'm Dr. Frank LaMar. I'm here today with my colleague, Dr. Julian Conejo. Welcome, Julian.
Thank you, Dr. Frank. Thanks for having me here.
Let's talk about prosthetic design or prosthetic options. This is something that has been, in my career as a prosthodontist, at the forefront. And historically, going back 25 years, the materials that we had and the ways in which we made our prosthetics were frankly so bad that I'm surprised we stayed in full arch as long as we did, because there's nothing that is more disappointing than prosthetic failure in advance of whatever the patient's expectations have been. And so at Hybridge, we talk a lot about, like, there's no ideal prosthetic, is there, Julian?
No, I mean, these prosthetics are in function and are submitted to different challenges, right? So what we're trying to do is to minimize any possible percentage of our failure rates and try to, of course, maximize our clinical success. But we understand that we don't have a one-size-fits-all or only one material or workflow that will be successful in all the patients that we treat.
So give me a list of what are the three, I want to explain to everybody what the three prosthetic options are that doctors choose from for their patients, and we'll take them one at a time, pros and cons and advantages and disadvantages. So let's sort of take it from the top.
So monolithic zirconia has become the most used material and way of using the material worldwide, because monolithic zirconia for crown and bridge work is very strong. It's biocompatible. Nowadays we don't need to layer or stack porcelain on top, so has become very popular as a material option.
I just want to interrupt you for a second. When you and I talk about monolithic zirconia, in our minds, we also think of it as, if you turn it over, there is no metal in that at all. This is a fully milled prosthetic, only zirconia.
No cementation to tie bases, just a full zirconia framework that is going to be screw retained and sitting on the multi-unit abutments.
Gotcha. So we have monolithic zirconia. What else? What other options do we have?
Well, the other option, going back to classical Brandemark times when everything started, was using acrylic denture teeth, right, and a metal framework, and that's what we all know as a hybrid prosthesis, right? But nowadays there's been a huge change and development on this type of prosthesis, and I'm sure you can explain us more about the latest generation 5 of the hybrid prosthesis.
The connection of that framework is metal on metal implant, and so the connection is a metal on metal connection. And then over the top of that metal substructure is typically either a PMMA material that's fused to that framework, or a printed nano-ceramic these days, which is more common. But at the end of the day, it is a softer tooth piece fused to a very rigid metal chassis. Our Generation 5 prosthetic is a fully digital prosthesis with two pieces instead of a monolithic one piece of material. But and then let's take it to the third prosthetic design that we want to talk about.
Yeah, so the third prosthetic design, it's a combination of having this concept of a rigid and strong chassis as a metal framework, but now covered on top with zirconia. Definitely zirconia has the advantage that there's very minimal wear, discoloration, but when it's seated on top of a framework, it seems to be more convenient for the clinicians because it tolerates better slightly lacks of passive fit, which is kind of the downside of full monolithic zirconia restorations. The accuracy and the passive fit is key because it's not a forgiving material option.
Yeah, so this metal zirconia combination gives you the advantages of the metal chassis, the durability of that metal connection on the implants, and it also gives you, and we should talk about it now, it gives you the ability to cantilever beyond the implant support longer with a metal chassis that exists with, for example, our Generation 5 metal acrylic or metal zirconia. You have this ability to cantilever up to 2 teeth. We usually say that metal cantilever can be 18 millimeters, which is the sum total of a premolar and a molar. And monolithic zirconia gives us really the ability to cantilever only about 10 millimeters. Is that right?
Yeah. So having these metal structure under the zirconia shell, right, helps us extending the cantilever, and the zirconia structure can have the screw access, so we still maintain the retrievability that we like, right? If there's any situation, any complication, we can still unscrew these prostheses that has 2 layers, right? The framework, the metal framework, and the zirconia, let's call it shell on top, that it's bonded to the metal framework, but still we can remove it as a one unit, one piece screw retained prosthesis.
I like it. So if we're talking about indications and contraindications, or as a clinician, tell me when you would choose the zirconia on metal option. We call that, by the way, at Hybridge, we call that Prime Z. So let's call it Prime Z. The Prime Z, that option, when would you use it?
Yeah. So the Prime Z is a highly aesthetic prosthesis because it's made with multi-translucent zirconia, and the gingiva portion is layered with pink porcelain. So it's a high-end aesthetic prosthesis with a high flexural strength due to this reinforcement of the metal framework that we're talking. So when I would use that, well, maybe if you have a patient that came treated somewhere else with a monolithic zirconia with a fracture, right? We know that it's a higher risk patient. Having that metal framework and the zirconia on top would be a great possibility, a great option.
Yeah, I think historically we've always looked at zirconia as its biggest advantage to me has always been incisal strength, right? You know, the thinner incisal buccal lingual thickness in long term, right? If you're going to use a non-zirconia material, you're going to have more flex and the potential with heavy bruxers and clenchers of more wear and tear over time. So obviously zirconia gets the nod towards more strength on the incisal edges and more durability for somebody who's hard on their teeth. It would also seem like, you know, when we're talking about implant positioning in the premaxilla and in the symphyseal area, and we're saying, okay, our implants are only from here to here, we do want to have 12 teeth.
Yeah.
So I guess depending on what that implant planning looks like, that metal chassis is important to giving some patients 12 teeth if zirconia is the material you want to use.
And this is a great prosthetic design because it can have a patient get only one surgery without sinus lift and invasive grafting procedures, but still get that full arch prosthesis with 12 teeth. So those are, I would say, good indications for the Prime C.
Right, and if you don't want to use zygomatic implants or pterygoid implants, then this cantilevering with a metal chassis is also very beneficial. I had a patient the other day where we talked a lot about highest lip line you've ever seen.
Okay.
And to me, I think customized gingival ceramics in that situation is also something. Ceramics can be higher aesthetics, higher premium product, And there are some people that have those high smiles where it becomes very important. Somebody like me, I smile as wide as I can. You're not seeing my gingiva.
Sure.
It becomes less important.
Totally agree.
Yeah. And let's talk about the metal framework with a non-ceramic toothpiece such as PMMA or a printed nano-ceramic, which again we'll call our Gen 5. And that Gen 5 restoration, advantages, disadvantages.
Sure.
Let's talk about that.
So one of the main advantages it's that it's a lighter prosthesis. And that is very important for the mandible, where the mandible is sustained by the muscles, right? So sometimes we have severe reabsorption cases that the prosthetic space is not 10, but it could be up to 15, 18
For sure.
millimeters, that it's actually difficult to access the screws, right? And if we make a monolithic zirconia with such a height, that could turn into a very uncomfortable material option for these specific
Are you talking
scenarios.
about its weight?
Its weight, exactly. And we did
We did this.
the measurements, right? And these combination of PMMA or printed resin with the chrome cobalt framework is more than half lighter than monolithic full arch prosthesis.
I think to be exact, we said our Gen 5 was 17 grams.
Yeah,
And a typical monolithic zirconia was 45 grams.
Yeah.
Right?
yeah.
It's almost three
Yeah.
times as heavy. And you and I both had patients who probably more mandible than maxilla.
Yeah.
That weight can be seen as a negative.
Exactly.
Yeah.
So that's a great option that we have for that. And also when we have bimaxillary cases, when we have implant bridge on the upper and lower arch, zirconia to zirconia, could be too loud, right? We have patients complaining for many reasons, right? And that's been one that after I put a lot of effort in making these two full monolithic upper and lower, patient comes back a week after, this is too loud. So also having...
I thought I only had those patients.
Right, no, we have them worldwide, all around. Having a material that it's softer, but with a strong chassis, I think that could be perceived more as a natural feel for the patient, a little more natural feel. And I don't want to get into a full design of something that is softer. We do need the chassis, and we need to have these PMMA or printed resin on top of a strong chassis, because you know what deflection can cause as well.
Yeah. Our Generation 5 design, which is what we're talking about now, has really been, we call it Generation 5, by the way, because it is the 5th iteration of materials and manufacturing techniques. But it is a chrome cobalt framework. And the reason is mainly because the cantilevering. We want to cantilever that 18 millimeters, but we don't like the modulus of elasticity of titanium. Titanium is very flexible.
Flex more, yeah.
And so we want something in that chassis that's very, very rigid. And so chrome cobalt, it's been 15 years since we went to chrome cobalt, but that really gives us such great strength distally. And so the other thing is how you bind the materials together matters. The people that have that have been around as long as I have, that remember what a typical hybrid looked like back in the day, they would delaminate, they would fracture, they would break.
Teeth will fall apart.
Those are not, that's 5 generations ago, right?
Yeah.
So, but the materials are very different, but the feel and, patient satisfaction, what I have found anyway in my patients is that we can say, oh, the implants are great and the teeth look wonderful and don't you look beautiful, but at the end of the day, if they're walking in, they're saying it doesn't feel natural, then there's nothing you can say.
Yeah.
And you can try to talk them into, well, it's not your own teeth and whatever, but the reality is how it feels in their mouth matters. And the more rigid the material, such as the Prime Z option or the monolithic option,
Zirconia.
those are unforgiving.
Yeah.
And they feel differently. And our natural teeth have that percussive feel that typically rigid materials don't have. And so, we've always, I've thought over time as I've done both materials that this Generation 5 concept is really about adaptability, adjustability, and natural feel. It's thinner, it's more, and post-implant placement or post-delivery, we have the ability to customize embrasures, customize contours, cheek biting, lip biting, lisping, slurring. These are all the realities of full arch. Actually, nobody really talks about them.
Yeah.
But sometimes this Generation 5 it's a bigger target on the target. It's just easier to hit the target sometimes.
Yeah, and also it has modifiable intaglio surface, right? That many times we can have patients come back with phonetics problems, and if we design zirconia restoration with a metal framework underneath, all those aspects need to be spot on. While with this alternative of the Gen 5, it's easier to adapt and adjust. So I think that's also a great advantage.
Great. Let's talk about the monolithic zirconia, which internally at Hybridge we call that MZ for obvious reasons. Give me an indication of use.
Yeah, so a monolithic zirconia restoration will be totally indicated on a patient that the implant distribution is pretty good in the arch, and we don't need to have more than 10 millimeters of a cantilever. It's an affordable prosthetic solution.
Yeah, it's a lot less affordable lab bill, isn't it?
Yeah, actually the cost of zirconia as a material itself, it's much more affordable than the comparable ceramics that we have been using and comparing with for the manufacturing. So I would say straightforward case without needing to extend more than one tooth distally. Cases where you might have those 10 to 12 millimeters of prosthetic space, not making it a very heavy prosthesis. I think that it works well. Nowadays, what we're using to make them look better, we're using as well multi-translucent zirconias with liquid pink porcelains. So this is a painted pink material to simulate the gingiva, but with the improvements of the design features that we have in the softwares, as they come out of the milling machine and with manual finishing and these liquid porcelain added to that, we're seeing very nice results as well in a simple prosthetic design.
Yeah, the MZ option in my practice tends to be, I would say, more our base option because it's a little less expensive. We typically use it when we're only doing one arch, like you said, because of the percussive issues. We want to make sure that we don't have to do a lot of cantilevering. Right. And when the implants are closer together, but what we worry about with monolithic zirconia, and you and I have talked about this quite a bit, is that if the connection on the intaglio of this is zirconia, and we're screwing it onto the implant platform, and there's a screw in there that's forcing these two things together and holding it together, the concern in the industry, it's not just our concern, by the way, it's really those that know material failures over time. I think the biggest concern we all have is like, what does that screw in that zirconia on that pressure point look like 3 years, 5 years down the road? And that's something we don't have the answer to yet.
Yeah.
But it circles us back to accuracy. Why does accuracy matter? Yeah. More so it matters on these zirconia restorations.
Yeah, as I said, zirconia is not forgiving at all if we lack accuracy on the impression. So a good take-home message would be, if I want to be using the MZ, the monolithic zirconia prosthesis, I want to make sure that that final digital impression is as accurate as possible. So photogrammetry with monolithic zirconia, that's a
They
good
kinda go
combination.
together, don't they?
Yeah, they have to go together.
Yeah, and then lastly on that, with any of these restorations, and maybe more important when you're doing dual arches, upper and lower, and when you're doing especially or just upper arches, we know that patient satisfaction, there's a lot of things that factor into patient satisfaction, and the target for any either monolithic zirconia or our Prime Z, the target of occlusion, contours, aesthetics, you've got to actually hit the target very precisely, otherwise you're going to remake the restoration. And so there isn't really an adjustability with zirconia, and so oftentimes in our office when we're doing zirconia, we do another printed try-in, we do another iteration, another step, another appointment, because we really don't want to take a chance on putting something in that we can't adjust. And so there is a little bit more, in my opinion, the lab bill for an MZ is less, but the time requirement is a little higher.
Okay.
So for me, there's a little bit of a trade-off there.